Imagine you're hiking with a family member and they fall over a stump, ended up cutting their leg open to the point where it's bleeding profusely. You're about an hour into the trail, and help is probably going to take about an hour and a half to get to you. Would you know how to stop the bleeding? Would you know this basic life skills to help somebody in need, in their time of need? According to the National Trauma Institute, hemorrhage is responsible for over 35% of all pre-hospital deaths and over 40% of all deaths in the first 24 hours. I'm Jessica Anderson. I'm here from Western Carolina in the UNC program, and I'm doing this for my communications class. I'm here today to show you some of the basic first aid skills in hemorrhage control and how to use everyday items to stop the bleeding. The main thing to remember is to not panic in this situation. It could be really bad bleeding, and it could be just a minor cut. You just got to take every situation at hand. The first skill I'm going to talk to you about is how to control bleeding in the extremities. Bleeding can be very minor or can be very major. Minor can be controlled by a bandage and neosporin, but then the minor, you might have to put a tourniquet on somebody. Minor bleeding can be controlled with just a Band-Aid that we all know how to use, and some neosporin and maybe cleaning the cut out. Usually this will stop on its own. I'm going to spend more time showing you guys how to control the bleeding that won't stop, and that's the major bleeding. If the wound is dirty, try to clean it with maybe some water if you have it, but don't spend a lot of time on this. There's a lot more important things that need to be done than getting it cleaned at that time. I'm going to show you some of the equipment that we carry on the ambulance and that you can actually buy at the stores. We have a 4x4, and it's basically just a square pad kind of thing. Then we've got a 2x2, which is very small bleeding. This usually won't control a lot of stuff. Then we have an ABD, which is a little bit of a bigger pad that you can use to control bleeding, and this one is for some major bleeding that kind of comes like that. And also we have a 3-inch cling and a 6-inch cling. This is used to wrap around the actual bandage that you put on and apply pressure with. The 6-inch will be more for maybe a leg or a bigger cut area, and then the 3-inch will be maybe for an arm and a smaller area that's cut. Main thing with these that you want to make sure that you actually wet these. If you don't wet these, they'll stick into the cut, and it'll be a lot more damage when they have to pull it off. So the first thing I want to show you is just to do a regular bandage on an arm. So basically I would cut the clothes or expose the wound. He's in short sleeves now, so we're going to say that maybe it's in the arm. So I'm going to take this and I'm going to put some water on it. Just wet it a little bit so it's a little damp. And then you'll just stick it on the wound. Apply some pressure maybe for 30 seconds or so while you're grabbing a 3-inch cling. And then you'll take it and you'll start wrapping around. Try not to bunch it up, but just a clean wrap around. And if you want, if it's a little bit of more of a bleeding wound, you can add a little bit of pressure by twisting it and putting it over. And then we'll just go ahead and do all the way until the end of it. And once it's like that, you just add a piece of tape up to the end of it, just to hold it there. If this starts to seep through, do not take this dressing off. This is already starting the clotting factor. Don't take it off. Just apply another dressing on it and wrap it again, which you may have to do with these kind of dressings. If it needs a little bit more pressure because it's not stopping, just apply more pressure onto it. Maybe do a couple more twisting maneuvers to keep it bandaged up. If you don't have any equipment, I mean, the best thing that you have, if you just have your shirt on your back, grab your shirt off, throw some pressure onto it, and just hold it like that until somebody can get there. Another way to control bleeding is, I don't have any with me today, but it's called quick clot. It's also called combat gauze. You can buy this at Dick's Sporting Goods or Bass Pro. They both have them, and It's been used in the military for a very long time, but it's just now coming to be civilian use. And it's basically like this kind of gauze, but it's got clotting factor in it that will control the bleeding. If you have time, watch a video of it. It's amazing how it works. The steps that I found to actually use it is from zmedica.com. The first thing I want to do is expose the dressing, or the wound I did there, and you'll pack the wound. So you're going to take the gauze and you're actually pack it into the wound, because it's going to go over the artery. That's what stops it. Do not wrap it around like I did with that. It's not going to help it. You've got to pack it so it packs against the artery itself. Once it's packed, you can take some 3 or 6 inch cling and wrap it around it just to keep it in place. Usually it stops the bleeding pretty fast. If it's a bigger area, you might need 2, 3 of them, but usually it's very. When direct pressure and wound care won't work, you'll need to use a tourniquet. Tourniquet is the last resort to any kind of controlling the bleeding. This is used when all other methods won't work. It can only be used in the arms and the legs. Once a tourniquet is placed, do not remove it. These people need to be transported to the ER so they can effectively take the tourniquet off. I'm just going to show you some steps of how to place one. Let's say the wound is right here. You'll want to place the tourniquet 2 to 3 inches above the wound. Do not place a tourniquet over a joint, talking about the elbow or the wrist or a knee or ankle, and you don't want to place it over the wound itself, so then you'll just tighten it down until either the bleeding stops or until the patient starts to feel some pain. If it starts feeling any pain, loosen up the tourniquet a little bit because it's too tight. Also, you might want to check a distal pulse. If they start to lose a distal pulse, talking about the pulse right in your wrist, then you'll need to loosen it up, or if their hands start turning blue or numb, that's when it's too tight. Some cases might need a second tourniquet, which will go right above the first tourniquet, about 1 inch probably away. And all tourniquets are going to go between the wound itself and the heart, or it won't work that if you do it below the wound. Also, there's some alternative methods to making a tourniquet if you don't have an actual tourniquet itself. You can use either a belt, a piece of cloth, a bandana. One of the alternatives that I think works the best is a bandana. You twist it up and you tie it around the arm. When you tie it around, you place either like a stick or a pin or something like a hard, small surface, and you'll twist it to make the tourniquet effect. Once you achieve that, it will just secure it onto the skin so that it won't move. Spent a lot of time talking about extremities. I'm going to talk about some special circumstances that can occur. Either anything in the abdomen region is going to be a very, very dangerous wound because of the organs that lie underneath. Usually when you have a penetrating wound to the abdomen, it's going to hit an organ underneath. These people need to be taken to the ER very, very fast. If they have a stab wound or something sticking out of their stomach that they got penetrated with, do not move this. You'll either want to put 2, 3 inch clings on either side and tape it down. Try not to move the object while you're taping because it can cause a lot of damage. If the object is not in the body and it's either like a gunshot wound or a stab wound, like if you're hunting out in the woods and somebody gets shot, you'll want to place either a 4x4 or an ABD over the wound. Usually gunshot wounds or stab wounds usually don't bleed as much as like getting sliced with something. If it's just a quick stab or if it's a gunshot wound, it usually won't bleed. So you'll just want to keep something to cover up and not get infected in it. Another wound that can occur in the abdomen region is a sucking chest wound. This occurs in the lung area. It's caused by a penetration, usually by a gunshot wound that has a hole in your lung, and which allows air to escape through that lung, which can cause a collapsing lung. you'll want to either apply maybe like something plastic or something to cover it up, something sterile. Let's hope that if you have something sterile. Best thing I've seen is to use a 4x4, the outside piece of it. You'll want to just tape it down over the wound, and you'll want to put 3 pieces of tape on the outside. This will actually cause like a vent so that the air will be escaped out but not sucked in. This will help a lot by keeping the lung from collapsing. Also, some harder places to bandage is the neck. If somebody's cut around their neck, don't place gauze around their neck. This will cause them to suffocate and be very uncomfortable for a patient. You'll place whatever type of gauze you want to use over the wound itself and tape it down, or just apply a little bit of pressure. Don't apply a lot of pressure. Another place that is a little bit harder to bandage is an eye wound. If they're bleeding from their eye, they actually make oval eye pads that will go over the eye itself, and you can either tape it down or use gauze and tape around their head. Also, if they somehow get something stuck into their eye, you'll want to stabilize whatever in their eye with some 3-inch gauze and tape it down, and then you'll over the unaffected eye, you'll put the eye pad just to minimize the movement of the eyes and to cause more damage. I know I kind of went through a lot of material today. I hope that you guys learned a lot about how to control some situations. Some that are a little bit more complex than the normal just bandaging. Knowing these skills will help out, a person that maybe is in your family by giving them that chance of not bleeding out as much. If you're an hour into a trail, you're going to be an hour by yourself with them, an hour to control their bleeding. Cutting down the effects of the bleeding and how long they're bleeding will help by shorter stay in the hospital, and maybe not having to get, a blood transfusion and having to go through that process. Or, they can just be transfused with normal saline, and it would be a lot easier transformation for them. Just remember to stay calm, and if you guys need any questions or anything like that, you guys can always give me a call and ask me. Thank you guys for coming.